Sonia is preparing stem cells for a hematopoietic cell transplantation. In most cases, the cells have to undergo several processes before they can be frozen and preserved. Further manipulation may also be necessary to match the cells to the patient to ensure their efficacy and safety. Sonia works in a clean room where about 500 donations of hematopoietic stem cells from bone marrow, peripheral blood, and umbilical cord are processed each year. They are used to treat patients with diseases such as leukemia and lymphoma, among others. Stem cell donations come from the 11 hospitals in Catalonia that work with the Blood and Tissue Bank Cell Therapy Service. In some cases, donations come from non-family donors obtained from other hospitals. In the case of cord blood donations, they come from 6 regions in Spain and Andorra through 58 accredited maternity hospitals, thanks to a program we call Concordia. The Blood and Tissue Bank Cell Therapy Service is responsible for processing, preserving, storing and distributing hematopoietic cells in Catalonia. We have 8 clean rooms, covering a total of 200 square meters for cellular and advanced therapy. These facilities are unique in a Spanish public organization and allow us to meet the needs of all hospitals while working on the research and development of new products. The Cell Therapy Service has an area classified as Type D, where hematopoietic cells destined for transplantation are processed. This room has 2 laminar flow cabinets, 4 cell processors, 2 nitrogen freezers, and 1 cell sorting device. The service is staffed by a technical director with 8 laboratory technicians, 2 process physicians, 1 quality assurance physician, and 2 hematologists. In the quality control laboratory, we ensure all processed products meet the efficacy and safety requirements. In this area, we carry out cell counting and viability and potency studies on cell products for transplantation. We have 2 hematological analyzers, 5 flow cytometers, 6 incubators and 2 readers, 5 laminar flow cabinets, and 1 test bioreactor. The Quality Control Laboratory services the blood fractionation, cell and advanced therapy, and multi-component collection units. It also provides support to researchers in immunohematology, tissues, and advanced therapies, as well as to other organizations. There are 7 laboratory technicians, 3 doctors, and 1 supervisor. This is the cryogenics room. This is where we store donations that have had to be frozen. There are 17 nitrogen tanks for storing hematopoietic stem cells from peripheral blood and bone marrow. These 9 tanks store 20,000 umbilical cord units ready for transplantation anywhere in the world. In fact, our cord bank is currently the leading facilitator for transplants in Europe and 3rd worldwide. Since we opened, 2,000 cord units have been sent for transplantation. The Cell Therapy Service also provides support to hospitals and research centres for the development of advanced cell therapies. We put our facilities, equipment, professionals and knowledge at their disposal. Thanks to the know-how amassed over the years, we are now also able to work as a platform for advanced cell therapies and bring studies that are in the preclinical phase into clinical practice. We are authorized by the Spanish Agency of Medicines and Medical Devices to manufacture cellular medicines. We have treatments with specific T lymphocytes for viral infections and others with cord mesenchymal stem cells. For example, in 2019, together with Hospital Germans Trias y Pujol, we developed a new bioimplant with stem cells to repair heart tissue following a heart attack. This year, we have manufactured cellular medicines for the treatment of 35 patients in clinical trials and for compassionate use in 15 patients. The cell therapy service is able to operate thanks to the support of other areas of the blood and tissue bank, such as the Transfusion Safety Laboratory, the HLA Laboratory, Immunohematology, Molecular Biology, and other departments in the organization, such as Operations and Information Technology. We are a public company attached to the Catalan Ministry of Health. In addition to the cell therapy service, we are also responsible for ensuring that all patients in Catalonia have blood and tissue for their treatments. Every year, nearly 300,000 people donate blood, plasma, tissue, and breast milk in Catalonia, all of which makes us a true bank for life.